Welcome to the fourth webinar in our series on women's health. We're super excited to welcome Dr. Jennifer Goto. She is one of our amazing women's health specialists here at Wisdom, and she's going to be sharing a deeper dive into navigating perimenopause like a pro. So she is a doctor of naturopathic medicine, a doctor of traditional Chinese medicine, and is a board-certified acupuncturist. Just a couple quick notes before we get started. First, we will be recording this and we'll send out the recording tomorrow for anyone who has to hop off early. Additionally, we'll have a Q&A session at the end. So if you do have any questions along the way, feel free to submit those via chat, or if you'd like to submit them anonymously, you can pop them into the Q&A box as well. And without further ado, welcome Dr. Goto.
Thank you. Thank you for that lovely intro, Anne. Thank you all so much for joining. Let me just share my screen. Let's see. Is that working?
It looks like it's showing the next slide as well.
Yeah, sorry about that. All right. How do I get out of here? Okay. Is that working now? No. Same thing.
Yeah, it's doing the same. I think before it was presenter view that you clicked.
Sorry about this, guys.
Oh, there it goes.
Is that working now?
Yes.
All right. Sorry about that. Okay, let's go back to the beginning. Okay, so today I'm going to be talking about all things menopause, and really I want to give you, kind of the rundown of what you need to know and how to make this not just something that you get through, but something that you actually thrive and, make this a time in your life that is like, really positive and you can use as a way to sort of like maximize your health as you go through it. Okay, my disclaimers. So the information in this presentation is for educational purposes only. You should never change a medication or start supplements without consulting your healthcare professional. In naturopathic medicine, we're all about personalization of plans and making sure that we really understand the history of the individual that we're working with. So a lot of stuff here is just sort of general information, and we'd obviously be more than happy to go through and make things that are completely personalized to you. All right, so why is menopause important? Well, half the population are women. All women, should we be so lucky to make it to that age, will go through menopause. By the year 2030, 1 billion women in the world will have entered or will be about to enter menopause. And most women are going to spend about 40% of their life in menopause, which is huge. And for some reason, it's still the part of our lives that we talk about the least. So why is that? Why doesn't anybody talk about it? We do know that women are much more likely to be dismissed by their doctors than men. Unfortunately, the statistic is even higher in minority women. And I think this leads to a situation where women are often sort of, hesitant to bring things up, or, they don't really want to deal with the frustration and aggravation of sort of being dismissed by their doctors. And oftentimes it leads to a situation where they just sort of think like, I'm just going to work it out myself, or I'm just going to tough it out, or I'll, just kind of get through, wait for the time to pass and wait for it to be over. Unfortunately, we do know that when women have more negative attitudes towards menopause, they are more likely to have more symptoms, more severe symptoms. The flip side of that is that about 50% of women do report being happier and more fulfilled post-menopause than they were in their 20s, 30s, 40s. And about 75% of women report making some sort of like positive lifestyle change during menopause. And honestly, these statistics are what makes this population my favorite to work with. Usually, oftentimes when women get to, their early 50s, they've had a lifetime of just like giving to other people, 20, 30 plus years of, maybe raising kids or taking care of a spouse or their careers or their parents. And this is often a time when women sort of decide like that they're going to focus on themselves and their health and put themselves first. And that's just like, it's a super exciting thing to be a part of. So So my goal is to, dispel all the myths about menopause, clarify questions that arise, and give women the tools that they need to like really thrive during this time. So, we say menopause when we talk about the transition, but really technically what we mean is perimenopause. So perimenopause is the transitional time. This is the time when women are often the most symptomatic. We refer to it as the second puberty because literally hormones are all over the place. So if we look at what's going on pre-menopause, what we see is that hormones have this fairly regular, fairly predictable cycle month to month. And then when you get to perimenopause, what happens is, things just sort of go haywire, and you're going to have times of very, very low levels of hormones, very high estrogen levels, hormone levels in general. And this is oftentimes what women will say. They'll just say, like, I feel like I am all over the place. Like, I feel like my hormones are all over the place. And because that is literally what is happening. And then post-menopause, we see that the hormone levels just become consistent. And so after, you get through the perimenopausal transition, the symptoms are much likely to be much less just because you're not having these massive fluctuations in hormone levels. Okay, so as far as symptoms go, there is no single universal menopause presentation, right? All women are going to have a different constellation of symptoms. Some women don't have any symptoms. Some women have loads of symptoms for a really long period of time. So there's this massive, massive spectrum. And it even varies based on like geography, ethnicity, things like that as well. So I think the ones that we hear about the most are, obviously changes in the menstrual cycle, and then what we call vasomotor symptoms. So these are hot flashes, night sweats, and then also insomnia and weight gain. The symptoms that we don't talk about as much are things like cognitive changes, skin changes, dental changes, ocular, hearing, joint pain, headaches. Like, I'm not going to go through all of these, but, point being, perimenopausal symptoms can be basically anything. They run the entire gamut. So we'll go through a couple of the sort of more common ones and talk about like the mechanism and why they're happening. So starting with vasomotor symptoms. So as I said, this is hot flashes and night sweats most commonly. Super, super common. So in about 60 to 80% of women are going to experience this at some point. And although we don't fully understand the mechanism, what we do know is that there are changes to what we call the thermoregulatory center in the brain that helps your body regulate its core body temperature. There's also some changes that happen within the nervous system and different neurotransmitter levels that are affected. But basically what happens is pre-menopause, this thermal neutral zone is quite large, right? So anywhere within this zone, the body is able to regulate the temperature of your body effectively. And in perimenopause, that zone really decreases, it really narrows. And so what that means is that the threshold at which you can start sweating is much lower, and the threshold at which you can start shivering is much higher. So, we commonly talk about hot flashes. The other side of this is cold flashes, which we talk about less, but definitely are something that we see pretty commonly as well. And, we really focus a lot on the sex hormones. So mainly estrogen, to some degree progesterone, and then, there may sort of sometimes there's an afterthought about testosterone. But one thing that's really important to realize is that there is this interplay between the ovaries making the sex hormones, the adrenal glands, and the thyroid gland. And so as those organs sort of, maybe change in their ability to make hormones, the other organs are going to try to sort of jump in and compensate. So one of the mechanisms that we see is that as ovarian function declines, so the ovaries are making estrogen and progesterone, basically the adrenal glands sort of get recruited to compensate for that. And as a result, so the adrenal glands make some sex hormones, they also make some precursors to sex hormones. And basically what happens is in the body's attempt to compensate for the lack of sex hormones being made by the ovaries, you're going to get surges of blood flow to the adrenals to try to compensate for that. Unfortunately, the same blood supply that goes to the part of the adrenals that makes the sex hormones also will stimulate the adrenal glands to make cortisol and to make other neurotransmitters, so things like adrenaline, right? So one of your fight or flight neurotransmitters. And this is really important. We'll talk about this more later, but it's really important because it's responsible for a lot of the other symptoms that we see in perimenopause. So things like insomnia has a big implication on weight, anxiety, things like that. And then also I mentioned the thyroid gland. So oftentimes we'll see changes in thyroid function around perimenopause. That can also have a big impact on anxiety, sleep, weight, all sorts of things, energy production, mental function. All right, so starting with cortisol. So cortisol is made by the adrenal glands. It's our stress hormone. And cortisol is supposed to peak early in the morning so that we're ready to sort of like get up and get on with our day. And then it's supposed to sort of gradually come down throughout the day so that at nighttime, you're nice and calm and ready to go to bed. So if you're getting these like aberrant surges of cortisol throughout the day, your sleep is most likely going to be dysregulated. You know, a lot of people will sort of feel like super, super tired all day and their cortisol is kind of flatlined. And then they get this surge of cortisol at night when it's finally time to go to bed and they're like wired and unable to go to sleep. So cortisol has big implications on sleep. Cortisol and blood sugar are also, you know, go hand in hand. So when your cortisol is dysregulated, we often see blood sugar dysregulation as well. There's a lot of other things in perimenopause that will increase a woman's risk for developing diabetes. And also anxiety, right? So if you're just having these surges of your stress hormone, you know, of course, you're going to feel much more anxious. One thing we see in menopause is not just weight gain, but oftentimes weight gain like right around the middle. And oftentimes that is a cortisol presentation. When your cortisol levels are high, you tend to hold weight around your midsection. So we see, you know, statistically about a 1.7 increase in fat mass per year with a 0.5 decrease in lean body mass. So we're talking about like muscle density, and we'll talk more about that when we get to bones, but super important. So cortisol regulation, so, you know, getting your cortisol levels back into like the proper pattern at the appropriate levels is something that can be really, really beneficial. Skin and hair changes. So the skin has a lot of estrogen receptors, and we know that there's about a 30% decline in collagen in the first 5 years after menopause, and then about a 2% decline after that. So oftentimes we'll see, you know, female pattern hair loss, sudden hair falling. And then one of the places that we see a lot of issues around skin change is vulvovaginal changes. So again, you know, super common, 60% of postmenopausal women are going to have vulvovaginal changes, but only about 7% of them are going to be treated. So if we look at the skin pre-menopause, when estrogen levels are still relatively high, what we see is that the skin is just thicker, right? It has more layers of cells. That thickness of the tissue allows the tissue to hold more moisture, to be sort of more like, you know, durable and less irritated. And then after estrogen levels drop, we see that the number of cells thick, that the layer of the epithelium is decreases, and the skin just becomes much more sensitive, right? So we can see more, you know, vaginal dryness, itching, irritation, burning. The skin can become what we call friable, where it's just very like sensitive to damage, and that can lead to, you know, pain with intercourse, you know, more risk of getting UTIs, things like that. You know, I've even had women who've had it so significantly that they literally have to like cut the bottom of their underwear out because it's just like the skin is just so irritated. And these symptoms do seem to get worse with time. And, you know, there's a lot of things that we can do to support skin, you know, besides collagen. There's, you know, topical estrogens and things like that. We'll talk more about that as well. Okay, so one thing I think is really sort of overlooked commonly in perimenopause is the brain. And really the brain is sort of at the root of a lot of the, you know, most of the symptoms really that are going on. So changes in the brain can account for, you know, fatigue, hot flashes, mood swings, sleep issues, stress, your ability to handle stress, your cognitive function. And the brain does go through massive changes during perimenopause. And unfortunately, a lot of these things are sort of perpetuating, right? So if you're not sleeping well, if you're really stressed, if you're more depressed, your cognitive function is going to decrease. And as a result of that, that's probably going to lead to worse sleep, more anxiety, more depression, because you're worried about, your cognitive function. And, women often think like they're going, like they're getting like early onset dementia during perimenopause because the changes can be so significant. Unfortunately, this is something that is not all that commonly addressed in conventional medicine. A lot of times they'll use antidepressants, which can be helpful in some cases, but I don't know that it always like really gets to the root of the problem. Mood. So, 40% of women report mood changes in perimenopause. We do know that there's a higher prevalence of clinical depression in perimenopausal women. And like I said, kind of just a perpetuating cycle where, changes in mood and changes in cognition and sleep, and they all just kind of snowball, unfortunately. So a really important place for us to intervene. And sleep, again, super, super important, right? And this can come in a lot of different presentations. So it can be difficulty falling asleep, inability to stay asleep, the dreaded like waking up at 3 a.m. and not being able to go back to sleep. And really common. So in about 50% of women, and, like I said, really just perpetuating the problem. Sleep is so important. It's the time when your brain is healing, your body is healing, where your immune system is really doing a lot of like the cleanup work in the body. And, not sleeping is going to increase your risk for all sorts of, chronic illnesses, cardiovascular disease, also just your ability to like function and be present. And so it increases your risk of, getting into accidents and things like that. And unfortunately, there is a tie with, poor sleep, and your risk of developing Alzheimer's disease. So again, super important place for us to intervene and make sure that you're sleeping well. Joint pain. So I think this is one that people actually don't really attribute to menopause that frequently. And it's oftentimes like misdiagnosed as arthritis, whether that's osteoarthritis, rheumatoid arthritis, or it could be medication induced, or a lot of women get diagnosed with fibromyalgia. This is a place where we do see hormone replacement being really, really helpful. We can also think about other things like, supporting collagen production, really making sure that inflammation levels throughout the body are low, clean up the gut. That's super important, one, because a lot of inflammation does come from the digestive tract. Changes in risk factors. So, we focus a lot on the sort of like immediate symptoms, like the hot flashes, the anxiety, the things that we feel, day to day, moment to moment. But if we sort of step back, we have to look at the backdrop of what is happening as our hormone levels are changing. And we know that, pre-menopausal women have much lower risk of cardiovascular disease, of, decreased bone density, Alzheimer's, and other neurological conditions. And then as hormone levels drop, the risk for those conditions really increases pretty exponentially. So, like with bone density, for example, our bone density actually starts decreasing in our 20s. And it will hold like fairly steady until, perimenopause. And then we're going to see a pretty like steep decrease. And bone density, so your bone is like very highly metabolically active tissue. Your bones are constantly being broken down and new bone being laid down. And this process is just happening our entire lives. Unfortunately, when we get to menopause, what happens is the bone breakdown part of that equation carries on, but the cells that are responsible for laying down new bone stop working as well. And so we end up with this pretty significant, net loss in bone. And this is, one of my favorite things, because it blows my mind that, women usually don't get bone density scans. Insurance won't allow it usually until like age 60 or 65, when they are well through menopause and have been, having severe bone loss for many, many years. And usually by the time that we catch it, when they first get their bone densities tested, a lot of the damage has already been done. And it's much, much more difficult to rebuild bone than it is to prevent bone from being lost. So one of the things I would really, really encourage is to get bone density scans done as early as you possibly can. With how stingy insurance is about them, you would think that they're like thousands of dollars, but it should cost, $85 to $115 out of pocket. So really inexpensive, and honestly will just save you a lot of time and hassle and money on supplements and all sorts of stuff down the road if this is something that we can get ahead of. Alzheimer's disease. So about 2/3 of the people in the world with Alzheimer's disease are women. Once you get into your 60s, you're actually twice as likely to develop Alzheimer's disease than breast cancer. And this is another place where estrogen seems to have really good preventive and protective effects on the brain. So, when we talk about these other conditions that are affected by menopause, we sort of have to look at like, what are our treatment options? How good are they? How expensive are they? How easy are they to comply with? Like, what is the way that we can, set you up for success as best as we possibly can? And, so for cardiovascular disease, we have a lot of things that we can do to, protect cardiovascular health and, keep inflammation low and balance blood sugar and all sorts of stuff. And same thing with bone density. We have a lot of tools for that. But Alzheimer's disease is one where estrogen really does seem to have a sort of like outsized benefit, versus a lot of the other things that we can treat. So we'll talk more about hormone replacement and when it's appropriate and who it's appropriate for and all of that. But where to begin? So we really need to make sure that your foundation is strong, right? So making sure your mineral status is good, you have all of the correct nutrients, because a lot of these deficiencies, well, a lot of people are just deficient as a baseline throughout their entire lives, and then these deficiencies sort of get exacerbated during perimenopause. And, particularly if we're talking about a woman with really bad night sweats who's like waking up to change her clothes and her sheets 2-3 times a day, think about the amount of electrolytes that she's losing. A lot of these other minerals are really important for cardiovascular health, for maintaining muscle mass, for balancing blood sugar. So all of these things, we just have to make sure that the foundation is strong and your body has all of the appropriate building blocks it needs to be as healthy as possible. Fix the gut. So naturopathic medicine, we're all about fixing the gut because so many things begin in the digestive tract. So particularly when we're talking about hormones, there are bacteria that live in the digestive tract that make something called equal. And equal is a soy isoflavone. So it has sort of like an estrogenic effect on the body. And the studies show that women who have higher amounts of these equal producing bacteria tend to have fewer and milder menopausal symptoms. Another reason we need to look at the gut is that we need to make sure you're absorbing your nutrients. We can give you all the supplements in the world. We can give you, you can be eating the cleanest diet, but if you're not able to absorb the nutrients, then unfortunately, we're just not going to see the results that we're looking for. There are other things that can begin in the digestive tract that can just sort of like exacerbate other perimenopausal symptoms. So imbalances in the microbiome, inflammation leading to joint pain, like I said, or, even things like a candida overgrowth that is going to make you crave sugar. And we know that sugar is like a really big trigger for hot flashes. So a lot of stuff that can come back to the digestive tract. And then, as I said before, we need to support the adrenal glands, make sure the thyroid is functioning optimally. All right, so bioidentical hormones. So I think it's kind of interesting if we look back at the history of hormone replacement therapy, and it kind of started off as like this great thing and solving a lot of problems. And then we went to the opposite extreme and like hormones are so dangerous. And I can't believe we ever gave anybody hormones. Nobody gets hormones under any circumstances ever. And now we've gone back to the complete opposite extreme where it's sort of like hormones for everyone all the time under all circumstances. And, I think the reality has to be somewhere in between. And obviously we have to look at the individual and find out what is right for them. What is, the best way to treat their constellation of symptoms, and also look at, kind of the bigger picture as well. So not just the day-to-day symptoms, but also looking at the other systems that we need to protect and things like that. And there's all sorts of, nuances and different ways that we can go about delivering hormones. There's different delivery methods. We can do oral, we can do topical, we can do patches, we can do, local for vulvovaginal symptoms. There's all sorts of different ways that we can sort of personalize the treatment to exactly what the woman needs. And the studies do show that on average, life expectancy seems to be about 3 years longer in women on bioidentical hormone replacement. So a lot to get in there, a lot of nuances, but definitely seems to be a really beneficial and protective tool in a lot of cases. Okay, so that's all I have. So I'm happy to open it up to any questions that anybody has.
Thank you, Dr. Goto. That was so comprehensive and so detailed. I do have a couple questions that have come in.
Oh.
So let's see. This first one is more specific to having a hysterectomy in a few years to reduce ovarian cancer risks. So this individual will wake up from surgery basically in menopause.
Mhm.
So she's felt very scared by the thought of immediately being thrown full-fledged into menopause and what that's going to mean for physical, mental, and cognitive health to not have sort of that
Totally,
transition period.
totally.
So for women like this, in addition to hormone therapy, what other tools are available to make menopause less menacing and more manageable?
That's a great question. And definitely, I mean, so many things that we can do, so hormones are not the only thing that we can look at, but when you go into like a surgical menopause, you definitely have to look at all of the other systems that are sort of losing the protection from having those hormones. And so I don't know, I guess, if the reason for the surgery in the first place would lead to a situation where they would want to use hormones or potentially not, but definitely a lot of herbs that we can use to mitigate hot flashes, anxiety, all of the mental health stuff, and then really focusing, you're really going to want to focus on bone health, on cognitive health, on cardiovascular. Exercise, super, super important. Just, I mean, there's a million things that we can do. And if you want to add to your question or talk about that more, I'm happy to go into more detail about that.
Amazing. So it sounds like it's really, really individual, like in terms of like what's being affected and where.
Very, very, yeah. And I think, especially whenever there's sort of like something that's happening because of a potential cancer risk, we want to make sure that we're being super, super diligent and careful with what we're recommending, because we obviously don't want to do anything that would mitigate the beneficial effects of like having that procedure in the first place. But and I completely understand the concern for what that means long term, but there's a lot of things that we can do.
Awesome. Thank you. So next question here, we've got a couple minutes left. So next question is, oh, this is a good one. Is it true that our perimenopause and menopause experience will resemble that of our mothers, or is that a blanket answer and there's more nuance to it?
I wish I could tell you. Sometimes there is, like a lot that we can sort of glean from it, and sometimes no resemblance whatsoever. And I wish I could work out how to know, when that was going to be relevant and when it isn't. And I just don't. I'm sorry.
So
And
same.
not only that, there also doesn't really seem to be quite so much of a correlation of like women who had, like fairly easy periods are going to have a fairly easy menopause. Like that also doesn't really seem to correlate, unfortunately. So that's honestly one of my obsessions with menopause is like, how do we know? How do we know what to expect? I want to know what to expect. And it's, I don't have a good answer for you, unfortunately.
So it's very individual. Yeah. Okay, next question here. So how early should I start working on my like quote unquote perimenopause preparation?
I mean, that's a great question. And I guess it kind of depends on what aspect of it, and so Anything that we can do to, I would say like in the earlier years, support just like ovarian health to, sort of extend the longevity and working on, keeping inflammation and stress and oxidation, all of those things low are going to be beneficial. Are you talking about like if you're sort of like starting to see symptoms, like when is it a good time to go on hormones or like, things like that? I mean, usually with that, we tend to not, jump directly into hormones and do things that are, in the earlier stages, a little bit more palliative, a little bit more sort of, treating symptoms before just like rushing to put everybody on hormones. But, again, it is, very individualized. But, I guess I would say like the sooner you can start laying the foundation, the better. Um, yeah, I guess that would be my answer.
Amazing. That is super helpful. Well, it looks like we are at time. I know we've got a few more questions, but I think we'll have to save them. I know Dr. Goto is also going to be contributing to a blog post that's going to go up on wisdommedicine.com, so we can maybe answer some more of these questions there. So thank you again, Dr. Goto, for sharing this deeper dive into navigating perimenopause like a pro. And thank you everybody for attending and for asking such great questions.
Well, thanks for having me, and thanks so much everyone for joining.
Amazing. Thank you.
All right. Bye, everyone.